A lot of people said to me, don't do it, don't do it. Those 2 surgeries ended up costing me 10 years of regret, pain, and time that I can't get back. My name is Eva. I am 35 years old. I am a bartender. From the moment I clock in at work, it's go, go, go. And at times I have to forget. It's a bit of a struggle about the pain. I suffer from bunions and hammered toes on both feet. These 2 just naturally overlap. The second toe does not touch the ground. The worst part is if I keep going, I'm in pain, but if I stop, I'm in even more of pain. I have to walk on the outside of my feet. My feet are on fire. It's kind of like walking on hot coals. They'll start throbbing. If I'm standing still, I have to shift the weight from one foot to the next. All of my weight goes to my last 3 toes, so I'm in constant pain. I've gone through a lot of different shoes trying to find the most comfortable ones, a lot of expensive boots. I have to use a toe separator, and I check it, try and get it in the shoe before they move. And these are the shoes that I can wear every day. My sandals, I don't like to be seen. I try to ice my feet, yogi toes. I just live in pain. This is a struggle for me. They just burn constantly. The pain has been so bad that I wear restaurant-style sneakers.
And when she takes them off, I see the blood coming out.
If I know I'm going somewhere, I do a phone check, wallet check, Band-Aid check. A cousin's wedding, I ended up with the bloodiest feet. At that point, I told myself, beauty means pain, so I have to choose one. I need surgery. In 2012, I moved to Spain. A lot of cobblestone streets, and I had a lot of walking to do. I couldn't take the pain anymore. It was constant throbbing in the bunion. And I thought, this is my time to be able to get my surgery. Went to see a doctor, and of course he said, no problem, I can help you. I remember checking myself into the hospital and being so excited. And I did ask him, are you supposed to put in a screw or anything? He said, we just shave it off. So I thought, okay, well, he knows what he's doing. Yeah, no, he didn't. The surgery didn't work because the bone went back. He didn't secure it. He just basically bandaged it. He even suggested I go and dip my foot in the ocean to reduce the swelling. And so my foot got worse. My toes became more severe hammer toes. Even now, when I open my closet and I try to wear things that would make me feel a little better, my mind goes straight to sadness because I have to always start with my look with the shoes that I can wear. I would love to wear this with a strappy heel, but I know that strappy means pain and blood. Worst part of the pain is that I always have a burning sensation on my heel. There's really no other part of my foot that I can use that's pain-free. I suffer from lower back pain, shoulder pain, I hunch a lot. I do this a lot when I'm standing behind the bar. I always catch myself cracking my ankles. Sometimes I even wake myself up from the cracks. After having a bad experience in 2012 with my surgery in Spain, I went and met with a doctor in Mexico. And I was sure to ask all the questions because the first time I had blamed myself and thought I didn't do things right. If one bad surgery happened to me, 2 can happen to me, right? So I went ahead and got another traditional bunionectomy.
Just got out of the surgery that took longer than expected.
A little bit of fear, there's a lot of risk.
It was a 4.5-hour surgery.
And they come over to me after the surgery is over and they say, oh, unfortunately you waited too long in between surgeries to correct the first surgery, and there's a lot of scar tissue, proving to be a little challenging. So we tried to do the best that we could with what we had.
And all bandaged up.
5 weeks after the bandages come off, I felt a little bit of my stomach dropping, thinking like, not again. A month after surgery, I think I was walking on a cane and I'd followed all doctor's orders. Definitely feeling hopeless.
Today's October 7th, 2020.
And I can get a little emotional because I've been through so much.
Finally gonna get these suckers fixed.
With the feet and just hoping that they look normal. I get so emotional I can't really look at them because they look worse now than they did before. Is this just how I'm supposed to be? I was doing some research online because during this research, I came across Dr. Khosroabadi. I found one of his YouTube videos and he had helped another patient with severe bunions like me. I like most about him is you can connect with him. He takes you behind the scenes. With Dr. K's work, I only saw some difficult cases and I thought maybe even harder than mine. If he can do this with them, there's hope for me.
I've done severe cases in the past, but those are the patients that have come to me. With Eva, it's different because she's had 2 failed surgeries. She had 1 failed surgery in Spain about 10 years ago, and she was looking forward to go get this corrected in Mexico. And when you're given a foot that's been operated on, it's a lot more challenging. What I have here, these are standing CT scans, weight-bearing CT scans that I have done. When the patient is standing, we can see the foot from every angle to see if there is any changes and the relationship between the bones. When the patient sits and it's non-weight-bearing, the bones are on top of each other differently than when they stand. So her case is very severe. A revision case, weight-bearing CT scan is even more important because it shows me rotational deformities, whereas a 2D X-ray will not show that. On this side is before she made her trip to Mexico, and on this side is what she has right now. And you comparing these 2 X-rays, there is not much of a difference. I mean, they have not done anything. They have just cut the bone and put 2 screws here and just got out. Well, if I put this over here, it would match. They have not changed the foot, they have not moved the bones, they have not realigned anything. I'm just in awe how this was even done. I've never seen this. I've never seen this. I feel really bad for her. I'll help her as much as I can.
So you can see I had the traditional bunionectomy on both feet.
Yeah, the first thing that sticks out is like how long of an incision you had over here. When I went in there and saw the big scar, oh my God, what have you done? I still see you have a bunion here. And on top of that, the bunions look even worse. She was even in more pain, especially at work. You can't
bend the big toe either.
Eva suffers from a severe bunion on the left and a moderate to severe bunion on the right. She has very bad scarring from the hammer-toe surgery they've done for her in Mexico. You have such a big scar, means that it was so invasive. I honestly don't know what exactly they've done. They didn't really correct the alignment for you. It's definitely more challenging right now than it was at the beginning.
Now I'm like, doctor, fix me.
The condition of the joint is pretty bad. I don't know what they've done. Ligaments and the tendons I cannot see, but just during examination, they're kind of loose. I'm not sure which ones they've cut, moved, or even severed. I think I'm definitely going to try to help you. It's a difficult case. So this case is definitely very challenging for me. If I was operating on her for the first time, I can for sure with confidence tell you that I could fix her foot perfectly. But now she's had 2 failed surgeries to a point that I don't even know what the results will be till I finish.
Positive that 3rd time's the charm, and this is the 3rd and last.
The day is here. We're gonna fix your feet once and for all. I feel very bad for her. She's a young lady. She has a whole life ahead of herself. The entire thing should take about 2.5 hours. You ready for it?
I am so ready.
And I'm ready to get this thing started and help you out. Okay, let's do this. All right. She's already asleep, numbing her foot up. Just when I go in to do the injection, I feel the scar tissue just in between the toes. So that's gonna be challenging. So we're gonna start with the left foot. So my first challenging part is to remove these screws that I have no clue what size they are or what kind they are. 3-5. Won't go in. I need a smaller version of this. Do you have it? Let's try the other screwdrivers. Ooh. Okay, I'm in. So we took out 1 screw, 1 done. Remove the second one. Not sure why they use so many different types of screws. So now let's fix the bunion. Let's make our incision. It's very tough. A lot of scar tissue here. which I usually don't encounter. So I'm gonna use a saw on this patient. I usually don't use a saw, but I have to make a very precise cut. Out of 2 of the surgeries she's had, nobody has corrected her deformity. So I'm taking that much wedge out so that way the bones can tilt. And as you can see, her bunion is starting to correct. So it's time to shift the bone now. Normally this part is very easy, but because she's had multiple surgeries, see, I cannot even get my forceps into the canal, which I'm supposed to be able to get in easy. So I'm just trying to realign the joint, and it's kind of difficult because of all the scar tissue. I'm using every tool I have to get this thing realigned. I have a very good position right now, as you can see right there. The joint is nicely aligned. I just have to get it fixated in that position. I'm gonna put 2 screws in this one. It's very tough to drill through this bone. Putting our first screw in. So now we're gonna do a capsule release to see if we can get her toe straightened out, the 2nd digit, give her some more range of motion. So her bunion is corrected. You can see the toe is nice and straight when you look from the top. She just has a little bit of skin memory that pulls the toe that way. We're gonna tape it. I'm gonna fix her 4th digit right now. Yeah, so this was a tendon issue. I was able to correct it, so now it's nice and straight. We did minimal incisions on the sides, just 3 small incisions, and also 2 on top to take those screws out. I think we're done. So we're gonna move to her right foot. This foot is gonna be definitely easier, I hope. Let's see. So both screws are out. Now cut the bone and shift it. Yeah, a lot of scar tissue here. Again, a lot of scar tissue. Normally, I don't have to do this extensively. Look how nice that looks already. And now what we're doing is we're placing the 2nd screw. Release the capsule. So we're done. A lot more challenging, less bone to work with, even though it's still swollen right now. As you can see, the alignment is good. And then on this side, the results are actually very immediate, as you can see. Nice and straight, toe in good position. All right, let's do our happy face like we normally do. Completely a different outcome than she's had the last 2 surgeries. So I'm excited to show her what this looks like.
After my surgery with Dr. K, I brought home some crutches, but I was pleasantly surprised at how little I needed them. I felt great. I kept saying, wow, I'm not in any pain. I was just in awe of it. I was very mobile. I was making myself breakfast, walking around the house. I was even in the bath drinking rosé. I felt pretty independent. Honestly, the recovery process felt like a vacation to me. During my recovery, I could tell this was different because under the bandages, I could see that my toes were in alignment. For once in my life, I felt hopeful that this was the result I was longing for. My initial reaction when the bandages came off, my jaw dropped. Are these my feet? Are they really my feet? They looked like model feet. I kept bending my toes. Mobility was there. I couldn't believe it. I could model shoes now. I mean, look at my feet. Look at how straight they are. These scars are from previous surgeries. Bunion free. I've been waiting 20 years to wear shoes like this. I'm not ashamed that people are gonna see my feet. The things that I'm able to do now that I wasn't able to do before, go to Pilates, yoga. The biggest thing for me is I am a mom now. I have a 1-year-old baby. I couldn't run after a 1-year-old and carry her around with the kind of pain that I was experiencing. That wouldn't have been possible without the surgery with Dr. K. I can just really focus on being a role model for her. I'm just super grateful. My relationship with my partner has definitely improved. Having the feet that I had before, the pain I was going through was also transferred to him.
It's just a joy to see her so happy and so at peace with her feet.
My experience with Dr. K and his staff was amazing and positive, top of the line, state-of-the-art equipment. He was very patient, explained to me exactly what needed to be done. He always reassured me. We can fix this problem, no worries. 20 years ago, when I went for my first surgery, that was heartbreaking. It took me 10 years to try again and trust another doctor. My poor Franken feet have been through so much. So many scars. Is it normal to live in pain? Don't look anywhere else. Go to Dr. K. Don't put yourself through any painful experiences and disappointments. It was hard to think I'm done with this journey because they became friends. I'm just so grateful now that Dr. K was able to fix the unfixable.